Good evening. Welcome to the May meeting of the Pitt County Board of Health. I'd like to call the meeting to order. Our first item of business is to welcome two new members to our board. Dr. Adam Harrell is our new dentist representative, and Lowell Spade is our new engineer. Would y'all like to introduce yourselves, to say a few words about your background? Or
Sure. I'm Adam Harrell. It's good to be here. Thank you all for having me. Certainly an honor to sit on this board. I'm practicing private practice in Greenville. Been out of school about 3 years now, but I am a Greenville native. Grew up here, so it's good to give back a little bit. And again, glad to be here.
I'm Lowell Spade. I'm a mechanical engineer. I've been in Pitt County for about 20 years. I work at Pitt Medical Center now, and I do appreciate this opportunity to be on the board and look forward to it. Thank you very much.
Very good. We're very appreciative of the long-standing members that preceded you, and we welcome your talents that you bring to the Board of Health. So thanks very much. Are there any public comments this evening? I guess hearing none, we'll move on to the minutes of the previous meetings. We have three different sets of minutes to approve tonight. First, we did not quite have a quorum at our last meeting, so we have the minutes of the March 14th meeting to approve. Those were circulated earlier, and I hope you've had a chance to take a look at them or recall what was in that set of minutes. Are there any discussion of those minutes? Is there a motion to approve?
So moved.
Is there a second?
Second.
Okay. Any further discussion? All in favor say aye.
Aye.
All right. Those minutes are approved. We'll move on to the minutes of the April meeting. And actually, I'm sorry, this is the one that we didn't have the quorum for. So, yeah. So let's go ahead, and I hope you've had a chance again to take a look at those. Is there a motion to approve these minutes as well?
So moved.
Second. Any further discussion? All in favor say aye.
Aye.
Any opposed? All right, the minutes are approved. Dr. Morrow also circulated just a few minutes ago some closed session minutes from November 8th, 2016, which has a list of annual activities he's involved with. This was, again, all under closed session. And we also need to approve these as well. So may I have a motion to approve?
Move to approve.
Is there a second?
Second.
Any further discussion? All in favor say aye.
Aye.
Any opposed? All right, these are approved. We'll need to turn these back in to Dr. Martin and Jennifer then to okay, well, I think it's time for John Reed's fiscal report. Thank you.
Thank you, Mr. Chairman. Board members, you have the April 30th, 2017 financial report in your packet. We're 10 months into our 12-month fiscal year that ends June 30, 2017. I know we've got a lot on the agenda tonight, so I'll make this report somewhat short because it really hasn't moved much since our last couple of reports. Once you take into account the timing items to kind of match up revenue with expenditures, we're still looking at about a $500,000 surplus 10 months into the fiscal year. As I said that in previous meetings, we have not brought any of our budgeted fund balance into our revenue stream yet. So that $500,000 plus surplus is a very strong number with 10 months under our belt. I know we'll have some year-end expenditures which will probably eat away at that somewhat, but I think we're going to end up the year plus or minus about a $500,000 surplus without using any of our fund balance. It's going to have to be something pretty extraordinary to bump us off that, I think. That is due to a couple of things. We had a couple of unbudgeted revenue items that really brought in some revenue for us that we hadn't budgeted, and due to our vacancies throughout the year, and I think we're probably 12, 13, 14 vacancies just on average this year, that has reduced our personnel costs by about $580,000. That saves us some money. It makes us tougher to get our job done. We are actively recruiting almost every vacant position now, so I'm hoping to turn that around here shortly. And I'll be glad to answer any questions. I would like to make the report brief tonight. I know we got a lot of things on the agenda.
Thanks, John. Does anybody have any questions for him? Commissioner, any questions tonight? Or? Okay. Okay, well, let's go ahead. May I have a motion to approve?
So
Financial-
moved.
Is there a second?
Second.
Okay, any further discussion? All in favor say aye.
Aye.
Any opposed? All right, your fiscal report is approved, and guess we'll move on to the old business, which would be the fiscal year 2017-18 budget.
Thank you. Also, in your report, you have a comparison between the fiscal year 2018 requested budget, and that's the budget that this board approved a couple of months ago, and that's the $10,983,000 budget. Dr. Morrow and I met with the county manager last month, went over that budget. He came back subsequent to that meeting and asked us to make some changes to that budget. We had asked in our requested budget for two positions devoted to dealing with the rise in chlamydia and gonorrhea in Pitt County above the state average. So we had a nurse and a health educator requested, and those were primarily funded with county dollars. So the county manager has, in his recommended budget, he has pulled those two positions out, and that's reduced the ask of county dollars by about $121,000. We asked for a half-time social worker in our pregnancy care management program, which is funded with Medicaid dollars on a per member per month basis, and the county manager asked us to pull that half-time position out also. Dr. Morrow and I are going to meet with the county manager next Tuesday, so we're going to try to entice him into
Monday, I think.
What's that?
Monday, I believe.
Monday.
15.
We're going to try to get some of those positions put back in the budget. In our strategic plan, we wanted to deal with this rise in STDs in Pitt County, and those two positions were really strategically needed to do that. So the health educator comes also with a media package and some educational materials to try to get the word out. So we're going to try to get some of that put back in the budget at this Monday meeting.
The, just mentioned, John, the social work position, as you mentioned, is really paid for completely with Medicaid earnings. So
Medicaid earnings, right.
I'm not sure why the county manager decided to cut that position out, and I think we'll have to, it may just be a misunderstanding there that we can straighten out, I hope, as there wasn't any county dollars in that position to gain from, I guess.
So that's where we stand now. We'll, at the next meeting, we'll bring you an update. We do meet with a manager next week.
Okay, does anybody have any questions for John? And we need to go ahead and approve this, is that correct, or we wait until after finalizing?
Is this information action?
Just discussion?
Just discussion.
Discussion tonight, okay.
Yeah, I really wanted to
Requested
bring it back to, because of the change, since the county manager had looked at it, I wanted to be sure that this board supports us going back to the manager and re-asking for those positions to be put back in. And we also, next week, we'll be meeting with the commissioners during their budget workshop sessions too. So that'll be a point of discussion at that point too, I think also. But I just wanted to see if there were any other questions or concerns that the board has before we enter into those discussions next week.
Mr. Chairman,
Yes.
related to the next year's budget, one of the things we wanted to bring to last month's meeting, but we didn't have a quorum, was a request going into next year, fiscal year 2018, to raise one of our environmental health fees. This is the inspection fee for an existing septic system, and Mark's here if we have any questions. Our current fee is $50. And Mark and his team did some research, and they're requesting to increase that fee to $70. That's really based on, it takes staff about an hour and a half to an hour and 45 minutes to do one of these inspections, about 20 miles round trip average. So if you put the salary and fringe of an environmental health staff for an hour and 45 minutes, that comes out to about $61, $62. 20 miles round trip at the IRS rate comes out to about $10.70. So you add that up, it's about $72. Our all-in cost. Mark did some analysis of comparable counties, and you can see they're kind of all over the place. Johnston County at $25. I'm not sure if that's not a misprint, but they're the low man, and we've got Airedale County up at $250. So 70's, in the ballpark there. Pretty wide range of fees there, quite frankly. And then some adjacent close counties, you can see Craven, Greene, Martin, Nash, Wayne, they're all at $50. Edgecomb's at $75 and Wilson's at $100. So we're still in the ballpark, even our neighboring counties. We'll recoup a little bit more money through environmental health inspections. So we're asking this board to approve that, and then we can take that to the commissioners in our budget package.
Does anybody have any questions for John on this one?
And just to clarify, that is existing septic tank. So it's, most of what we're doing is new septic tank systems. Correct me if I'm wrong, Mark, but this is when we go back to an existing system and have to do if they've done a repair, we have to do an inspection, correct?
Okay. All right.
So we would need board action to approve that fee.
Move to
Mr. Chairman.
approve the change.
Okay, motion's been made. Is there a second? Second. Any further discussion? All in favor say aye. Aye. Any opposed? All right, thank you, John.
Thank you.
Electronic health record.
Oh, is that me?
I can do it. There's not a whole, we were expecting there to be a little bit more business with this today, but as we discussed the last several months, we've are entering into an agreement with Vidant Medical Center for an electronic health record on the Epic platform. That platform is being changed right now to a new version, which won't be available until August. So rather than install it now and have to change again in August, we're waiting until August for that to happen. But we're getting ready to take that request. We're ready to take that request to the county commissioners as soon as we have a contract. We were hoping we would have that contract end of last week. John spoke with them today, and it looks like it's going to be sometime this week before we get that contract, but we were hoping to go ahead and bring that contract to y'all tonight for your review. We can email that to you, but as we've talked about in the past, I think we're ready to go to the county commissioners and know exactly how much money we plan to spend on this system going into the next fiscal year.
Very good. So any other old business? Well, let's move on to new business. We have a presentation tonight on walkability by Allison Swart. So welcome, Allison.
All right. Good evening. So Dr. Mara asked me to come in and talk about walkability. And I wanted to touch on a discussion that we had last Board of Health meeting. We talked about pedestrian safety. So that is something that is important to walkability, and that is a part of the walkability conversation. But I did want to make a note that this is a little bit different, and this is focusing on walkability. So let's get started. So this generation of children may be the first generation with a shorter lifespan than their parents, and that is always a shocking statement to me. Many of you know this, but the leading causes of death in Pitt County are heart disease, cancer, and stroke. And I would feel pretty sure that most of us in here have been impacted by one of these, either directly or someone that we know. It's important to note also that all of those chronic diseases are diseases that can be impacted by physical activity. So what happened? We've unintentionally engineered walking out of our life. And we've done this so well that we've actually had to create a term, walkability. Sorry. Created this term, walkability, for something that used to be just a part of everyday life. You used to just be able to walk, and that's not so easy anymore. So what is walkability, really? And it's about connectivity. It's about being able to do the things you need to do and also the things you want to do without having to rely on a car. So maybe I want to go shop, but I also need to go to the post office. I need to go to the grocery store. And I can do all of those things without having to rely on a car. So we're going to take you back. Does this look familiar to anybody? This is downtown. It does not look familiar to me. I don't remember when Greenville looked like this, but I've been told that I think the picture in the top is from the post office. And then, of course, you can see Brody's. So you can see that somebody could go to the grocery store. They could go to the post office, or I'm sorry, to the drugstore, to the post office, get some lunch. They could run into Brody's and grab something if they needed to. And they could do all of this without having to rely on a car. So I took similar errands and I put them in MapQuest just to see what that would take to do that now. And now it would take me, it would be nearly impossible. It would take me 36 minutes and 13 miles to do this. So either it would be nearly impossible to do without a car.
And that included what?
What's that? In this
Errands.
one? This is going to the pharmacy, similar to what we just talked about, going to the pharmacy, stopping at Belk, going to the post office, stopping at the grocery store, and so it would take 13 miles. So the Surgeon General notes that walking just 22 minutes a day goes a long way in preventing chronic disease. And the CDC recommends 150 minutes of moderate intensity physical activity per week, which is 30 minutes 5 days a week. So the need for us to move is not new. It's just now that we've engineered it so much out of our life that we've now had to make these recommendations. And so I wanted to look at the second recommendation and really think about that for a minute. 30 minutes a day, 5 days a week. Really, what is that? If we lived in a society where we could, or in a community where we could walk, what would 30 minutes be? That would be walking to lunch and back. That would be walking just to do something simple, and you would easily get that. But now it takes an effort, and now we're in lines beside each other on treadmills trying to get that 30 minutes a day. So this is from the National Association of Realtors. Americans actually prefer to live in mixed-use walkable communities. 55% of respondents were willing to forego a home with a larger yard if it meant that they could live within walking distance of schools, stores, and restaurants. And according to one study, there are substantial and growing rental rate premiums for walkable urban office, retail, and rental multifamily over drivable suburban products. Sorry, that was a little bit of a tongue twister. But we've seen this in Greenville. So if you are familiar with the Boundary, that is in the Uptown area, it opened in 2015 at 100% capacity, and it is considered one of the most successful housing projects in the nation. Student housing projects. That's an important distinction. With a walk score of 93 out of 100. There's also there's a theory that more walkable streets can lead to less serious crime. So there is a theory that's called the broken window theory, and that is, it suggests that the presence of broken windows attracts more vandalism and then escalation into more serious crime. So based on this theory, there was a police department that focused on cleaning up the streets. They enforced speed, increased police visibility, removed graffiti, and they did see a drop in some drug crime, burglary, vandalism, etc. So we have a group called the Walkability Collaborative, and we have a mission to support and promote walkability efforts in Pitt County. The members, it's a multidisciplinary team. We have representation from DOT, Pitt County Planning, Pitt County Community Schools and Recreation, Uptown Greenville, Greenville City Council, Pitt County Health Department. And we also had a member from the Greenville area MPO that served as well. That position is vacant right now. But we can support other groups that are working on walkability and have an interest in walkability by assisting them, for example, with writing grant applications or providing letters of support, providing technical assistance as they need, and connecting them to resources as we are able. Just to give you a little bit of history on the Walkability Collaborative, we wrote a grant, or received a grant a year ago, and we were one of 10 collaboratives in the nation that were chosen to attend Step It Up Walkability Action Institute. So Chattanooga, Tennessee, Austin, Texas, Des Moines, Iowa, Knoxville, Tennessee were among the other groups that were present. We also secured funding for a feasibility study to provide a connection between Windsor Subdivision and Wintergreen Schools. So I don't know if you all are familiar with that, but with Windsor's a large subdivision, and they are right at the edge of Wintergreen Schools, but the kids cannot walk to school. They have to get in their cars with their parents and go all the way around down County Home Road in order to get to school. So what this is exploring is, would it be possible to add a trail, and what would it take to do that? So that's one thing that's being done now. We're also members of the Active Transportation Plan Steering Committee. So the Greenville area MPO is working on an active transportation plan now, and it is in the review phase right now. We also promoted pedestrian safety at National Night Out and Free Boot Friday with this fun fellow who's in our picture, and he was quite the character who protected pedestrians as they crossed. And they needed more protection than we would have liked to have seen. And this work is not new for Pitt County Health Department. So back in 2010, we had a grant called Communities Putting Prevention to Work. And this paved the way for most of the work that we're doing now with walkability, and built a lot of relationships. So it provided some examples of things that were provided from the CPPW grant. Were funding the crosswalk that connects the Alice Keene Park to and the community garden to the Pitt County Farmers Market, and also to the Wintergreen Schools. Provided funding for the development of a bike ped plan for the town of Farmville, and provided funding for Greenville Greenway expansion, or for the planning of the Greenville Greenway expansion. So we've unintentionally engineered walking out of our life, and we must recognize this and be intentional about addressing it. And that is, any questions?
All right, any questions for Allison? Thank you for a very insightful presentation.
All right.
Is there anything we can do as a board to help support this, or is this more for information for the public?
I think having your support is very helpful, just having that. And I think that as we get you know, I feel like we're moving forward. We've got a couple of activities coming along, and there's some interest in the community. So I think as we explore that a little bit more, there may be an ask that we have for you guys. But I think to have that support is very much appreciated.
Okay, very good.
I think, Mr. Chairman, if I can, one of the things I mentioned to Allison, one of the reasons I wanted her to do this tonight is there's been so much attention on pedestrian safety, mostly in Greenville. But that is a very real concern, and this board's, talked about that. The walkability collaborative, though, is really trying to help us build walking back into our culture. Because it's so important around these diseases like heart disease and strokes and diabetes and obesity-related illnesses. So, we've had a big part in that now going on for about 7 years since we did the communities putting prevention to work efforts back then. But I'm afraid the public still has a confusion between the two. So, and Allison had done another presentation in the community, and almost all the questions were really about pedestrian safety, not really about walkability. So I think people are getting these two confused, and we want to make sure that they do differentiate the two. The other thing I think, though, there's other walkability initiatives going on, particularly around Greenville, I'd say, that I think people have gotten confused with the Walkability Collaborative. So there's a walkability or a walking effort going on in West Greenville. There's a walking interest in the Green Loop in Greenville, uptown Greenville. There are walking initiatives in other places around the county, other projects that are going on, and we certainly, as a health department, want to support all of those, and will lend our support and help if we need to, like Allison said, with the collaborative to write grants if that helps, or try to find other types of support in the community. So I just wanted people to be aware that this is out there. It's a great thing that's happening, I think. I think the potential for Pitt County to be a walkable and bikeable county, not just a city, but the whole county, is tremendous. And it would really help us, I think, in terms of, our mission is to make sure that we protect, promote, and assure the health of all the citizens of this county, all the people in this county. And I think this is one of the ways that we can really engineer that into the future of populations for this county to come.
Very good. Anybody have any other questions? Allison, is there a phone number that if any of the public wants to give you a call and ask questions, follow up?
Yes, 902-2419.
So 902-2419. So if anyone has any questions for Allison, be sure and give her a call
Thank you.
during business hours.
Yes.
Thank you very much. Let's move on to Health Director's report.
Okay. Thank you, Mr. Chairman. I've got some sad news to report, unfortunately, tonight. We've lost a couple of very dedicated long-term employees recently. Angie Manning from our Environmental Health Food and Lodging Division has left us to go to Wilson County. She's taken over as the Environmental Health Director for Wilson County, and we're sorry to see her leave. John Reed just received a resignation today in his division. Jennifer Costanzo, who's been our medical records director, supervisor for a number of years, will be leaving us. She's going to Duke Hospital to further her career, but we hate to see her go, but wish them the best in their future jobs. And on a brighter note, I did want to let our board members know that we have a new director of nursing, Kimberly Hardy, who's out in the audience tonight. Kimberly started last month, and Kimberly has been with the health department for a long time. She came out of the nursing school at East Carolina University, became a public health nurse, and worked her way up from a public health nurse 1 to 2 to 3, and then to went back to school and got her family nurse practitioner degree and master's degree, and then is just about to finish her doctorate, also from East Carolina University. So we welcome Kimberly. She's got a tremendous amount of experience with our department, knows the staff, knows the county well. She's going to do a great job for us, so we're just real happy to have her in that position.
Congratulations. Yeah.
And I did want to update y'all on, just give you a legislative update. Crossover day happened a couple of weeks ago, so the bills that are still alive out there that we have some concern about in terms of public health, there's a body art regulation changes, so they're adding body piercing and puncturing and branding and scarification to the tattoo law that we've had for some time. A lot of people don't realize it, but our environmental health folks go out and inspect tattoo parlors, among the many other things that they inspect. And so this will bring those other things that have been being done under tattoo parlors, and we'll regulate them. So we think that bill has a very good chance of passing, and I think our staff's ready to absorb that work, if you will. They're already in there inspecting these folks. So we want to make sure that they do this activity safely and that they don't transmit particularly bloodborne pathogens while somebody's getting a tattoo or a piercing. So that bill, I think, probably is going to pass. There's some other ones that we are concerned about. The helmet law that would allow people under the age of 21 to not wear a motorcycle helmet. That bill is still alive in both the House and Senate. I'm not sure what's going to happen with that. A lot of the legislation this year has to do with opioid abuse. And so there are several bills that are still in there that'll help with addressing the opioid problem that is really a national problem, but it's certainly here in North Carolina. The natural milk law, which seems to come up every 2 years, as long as I can remember, that people want to drink raw milk, is back. And so it did make crossover. Not sure what's going to happen with that one, but I've got a copy of that if y'all would like to read that. And certainly we know about the dangers of unpasteurized milk and the outbreaks that occur. I think CDC has said the number of outbreaks has gone up about fourfold in the last few years as a result of states passing laws like this one. I think, was it last year or the year before, I think it was West Virginia, passed a raw milk law, and they invited all their General Assembly out to celebrate and serve them raw milk, and they had a huge outbreak. I think, I don't remember if it was salmonella, but they made a lot of lawmakers sick that year. So we certainly don't want to see that happen here in North Carolina. There's a good number of laws having to do with regulation of tobacco. Dr. Murphy had introduced a law to raise the age of smoking to 21. I'm not sure if that bill's going to pass or not yet. There's also a bill that came from the Senate that would allow restaurants to use outdoor grills. I don't know, Mark, if you know if that one's going to pass or not, but there's also a bill that would expand Medicaid coverage for nurse-family partnership. That's something we've been trying to get done for quite a few years. We had one of the first pilots for nurse-family partnership started here in 2008, and that's going very well. But it's been supported by grant funding from the beginning, and the Duke Endowment still today is helping us support that effort. That's an intensive home visiting nurse program for high-risk first-time mothers, and the results of that program have really been amazing. And so we hope that Medicaid will step forward and begin to pay for those services going forward. So that's sort of a summary. I've got some bills here if y'all would like to look at any of this. The rabies control law, which was something we acted on last year and took care of locally, but it looks like the state law is going to pass, and that'll take the place of our local rule, if you will, for making sure that animals are properly vaccinated. So I think that's it on the legislative update. I did also want to mention there's a Medicaid reform meeting actually tomorrow. The new Secretary of Health and Human Services, Dr. Cohen, will be here in Greenville at the Greenville Convention Center, 3 o'clock tomorrow afternoon. And this is the second of 4 meetings that they're holding across the state to listen to people's concerns about Medicaid reform. I attended one of those sessions last year under the Secretary Brazier when they did a similar activity. So if anyone needs that information, I've got that here for you too. Also want to mention our State of the County's Health Report. Amy Haddam, who's our Health Education Director, has been working hard on this new report. It's been approved by the state last week or just recently, and this will be coming out. I've got a printed copy that we can share with you tonight, but the final print is still to be done. But just to remind folks, the State of the County's Health Report is what we do in the interim between our community health needs assessments, which we do every 3 years now. So we'll have a community health needs assessment, which was done in 2015. Then we do a SOTCH, or State of the County's Health Report, for 2016, and that's what this one is. And then there'll be one again next year for 2017. And then in 2018, we'll do the Community Health Needs Assessment again process. And we've been doing those Community Health Needs Assessment in collaboration with Vidant Medical Center for the last few times. We're about 10 years now, really. And that's been very, very helpful. We're also moving towards a regional Community Health Needs Assessment with support from East Carolina University to try to make this even better than what we've had in the past. So we're very excited about the opportunities that may bring to us. And the first regional community health needs assessment is scheduled to be done in 2018. So more to come on that. But we'll have a copy for this sent out to all of y'all, the new report. Actually, you already have one, so we'll get you the final copy, though. And also in our August, which will be our next televised meeting, we'll actually present the data on the SOTCH report, and we'll have folks, our community partners, come in and present different parts of this SOTCH report to you at that point. Any questions about that? I know the new members may not be familiar with that, but do y'all have any questions? You good? Okay. And I'd just point out to you also, as you look through this report, you'll see a lot of the activities, because this is not all just what the health department done. This is what what the county has done. But you'll notice that behind a lot of these initiatives, you'll see VH. And that's an indication of Vidant Health, and that just means that they have put money into those efforts. Usually through the foundation, they've done that. So we want to thank Vidant Health for all the things that they've helped us do to improve health in this county. And you can see as you go through there's a lot of VHs. Just a couple other things, Mr. Chairman. I did want to recognize this is National Nurses Week. So our hats off to all of our nurses at the health department, but all throughout the county that Dr. Engelkey has many years of nursing under her belt, but we couldn't do a lot of what we do in public health without our nurses. So we just want to applaud their efforts and congratulate them. And last, also wanted to mention April the 25th, I was invited to the Vidant Medical Center Board of Trustees meeting, and they presented to us a resolution that recognized Pitt County Health Department for 100 years of service to Pitt County. And they mentioned in here there was 65 of those years were working with that hospital. So again, just a tremendous partner to have to help us get this work done.
Very good. Does anybody have any questions for Dr. Morrow? Well, still a lot of good work going on, and still, as we talked about during the centennial celebration, a lot of work left to do. So, does anybody else have any other business for tonight? Hearing none, is there a motion for adjournment?
So moved.
Is there a second?
Second.
All in favor say aye.
Aye.
Any opposed? All right, the meeting is adjourned. Thank you very much.